Hello everyone and welcome back to the third episode of IVSA Kelantan podcast program with me, Ada, and our new member, Jaya. Today's topic is banned veterinary drugs. The guest speaker is Professor Madya, Dr. Arifah binti Abdul Kadir. Dr. Arifah graduated from University Pertanian Malaysia with a degree of Doctor of Veterinary Medicine. Then, she continued her studies and achieved her Doctor of Philosophy in Pharmacology at the Royal Veterinary College, University of London. Now, she is a lecturer from University Putra Malaysia and is the head of the Department of Veterinary Preclinical Sciences. Her main specialization is in veterinary pharmacology, and she also subspecialized in various fields such as veterinary toxicology, phytomedicine, nanoscience, nanotechnology, and ruminant disease. Dr. Arifah is also an expert reviewer of drug registration in the National Pharmaceutical Regulatory Agency or NPRA. Hello, Doctor, and thank you for accepting our invitation. First of all, I think it's better if we start with some light questions. Can you give us some examples of banned veterinary drugs in Malaysia and why they are banned? Please, Doctor.
Bismillahirrahmanirrahim. Assalamualaikum and a very good evening to all. Thank you, Ada, for the kind introduction. Thank you also to IVSA UMK for inviting me to share my opinion, view, and my experiences about the topic on banned veterinary drugs in Malaysia. So, as for the first question, some examples of banned veterinary drugs. If you look at the FIT Act 2009, they are basically, they are classified into three categories, into antibiotic, hormones, and other chemicals. So I believe that our focus of discussion today will be on antibiotics. So examples of banned antibiotics, are avoparcin, chloramphenicol, nitrofuran, vancomycin, and others. To answer why they are banned, so I will just choose one example, that is chloramphenicol. A lot of research has been done, and the USDA and other agencies, they have found that animals that were slaughtered for use as human food contain residual levels of chloramphenicol, and this has been associated with aplastic anemia in human. So aplastic anemia is actually a blood disorder when the bone marrow is unable to generate new blood cells. So it causes problem in human. So therefore the drugs listed are banned globally. Okay, not only in Malaysia, in other countries too. So the use of this drug in Malaysia, if you look at the Act, in the FIT Act 2009, Regulation 2012, Sub-Regulation 3.1, it says that this drug, the ban is for only food-producing animals, the livestock animals, and in the form of feed additive. Okay, so with other drugs, there are other prohibition, which I believe that we can refer to the FIT Act 2009. I think I answered your question.
Yes, Doctor, you've answered my question.
Okay.
So we'll proceed to the next question. Have you dealt with banned veterinary drugs before they are banned in your research?
I haven't done any research on this banned veterinary drugs, but having said that, there are many research studies that has been done globally, before the usage of the drug is banned or prohibited, in veterinary medicine. So there are a lot of papers, a lot of work has been carried out, before they ban the use of the drug.
I see, Doctor.
Okay.
So if there are some clinics or practitioners that use these banned veterinary drugs, what actions should be taken on them?
Okay. Usually, the actions taken, legal actions, because they have to follow whatever stated in the FIT Act, 2009. But if they fail to follow whatever being mentioned there, so they have to pay the penalty. So according to the FIT Act 2009, under the regulation 2012 sub-regulation 3.2, it says that any person, who contravenes sub-regulation 1, it is actually referring to the drugs that are banned in Malaysia, commits an offence, and shall, or on conviction, be liable to a fine, not exceeding 10,000 ringgit, or imprisonment for a term not exceeding 2 years, or both. So that's the penalty they have to pay if they don't follow the whatever stated in the regulation.
I understand, Doctor. So another question from me is, has there been a drug that been released legally but then was banned due to any misuse or serious side effects?
Yeah, an example would be evaparcin. I mentioned earlier evaparcin. This drug, has been withdrawn, from the market. So what happened to this drug? It was used by many people in several countries, by veterinarians in several countries, as a growth promoter. That is in the late 1970s, including poultry. And then in 1980s, the vancomycin-resistant enterococci organism was described in humans. Okay, and later on in mid-1990s, a study showed in Germany where they used evaparcin, as a growth promoter. The vancomycin-resistant enterococci was isolated from the farms, which has been using a lot of this drug, evaparcin. The study also concluded that they made a correlation between the use of evaparcin and the emergence of the vancomycin-resistant enterococci. They concluded that evaparcin in animal feed was capable of encouraging resistance to other glycopeptide-based antibiotics, such as vancomycin, in human medicine. So even though they use evaparcin, it was shown that it could cross-react, to other glycopeptide antibiotics, such as vancomycin. I hope it's clear.
Yes, Doctor, it's clear.
Right.
There's also another question from me. As we know, there are some drugs that are used in humans and also in veterinary practices. So are there any drugs that are banned in humans but not in veterinary practices?
Not that I know of. Usually drugs that are banned in humans is also being banned in veterinary practice.
Then how about the drugs that are banned to use in veterinary practice but not in humans?
Okay, so one good example would be chloramphenicol, that I mentioned just now. It has got the severe adverse effects, and also the residual effect. So in human, so this drug is the use is being banned in the food producing animals, but in human, we still use this drug for eye infections, otitis externa, and it also being reserved, for severe infections, such as meningitis caused by Haemophilus influenza, and rickettsial diseases, typhoid fever, and sometimes it is also being used for the treatment of cholera. They are reserved drugs when we need them for severe bacterial infection, we can use them. So we don't have the problem of the resistance, the emergence of resistant organism.
So a last question from me.
Okay.
Was there any drug that was once banned in Malaysia but now legally available to be used in veterinary medicine?
Not that I know of. Actually, when I looked at the list, drugs that are banned in Malaysia in year 2012, and the recent ban was for colistin, colistin in 1st May 2021, and a few other antibiotics lah. So actually, the list of banned drugs, this is getting longer than the initial list. So I believe that we are not reversing the decision on the banned drugs in Malaysia.
I see, doctor. So I just want to say something. From our conversation, it seems that most of the banned antibiotics are on to the food producing animals.
Oh yes.
Yes. Okay. So thank you very much, doctor. And now I'll pass the platform to Jaya. Jaya, please.
All right, thank you, Ada. So, doctor, for the first question, people don't know which vet drug is banned, right? So, is there any actions or event done to bring awareness to the public about these drugs?
Oh yes, there are many. There are many venues and also many workshops that has been conducted. So we know that this past 2 years we were in the era of pandemic COVID-19. So all workshops, webinars, conferences are organized online, and so that's where the authority, they invite the expert members, to share their experience and also to deliver a talk, on the prohibition of veterinary drugs in the food producing animals, especially food producing animals. So besides that, we also get the information, on the updated list of prohibited drugs, especially like antibiotics, at the website, Department of Veterinary Services website, and also at the Animal Feed Act 2009 portal. Besides the conferences and seminars, which are like a very formal kind of platform for sharing information, we also organize awareness campaigns and roadshows for all the relevant stakeholders, such as the farmers, the clients, private practitioners, the pharmacies, and veterinarians, on the updated laws and regulation of the banned drugs.
All right, okay, for the next question, where can we, the general public, access reliable sources about which drug is banned?
You were asking on the access, on the reliable sources. So information can be obtained from the websites, to the DBS website or Animal Feed Act portal. So there you can look for the Feed Act 2009 that is more specific, for veterinarians, where there's a list of prohibited antibiotics, hormones, and also on chemicals. Okay. Besides that, you can also refer to the Food Act 1983, Food Amendment number 3, regulations 2014. So this is the updated version. If you look at the earlier version of the Food Act 1983, it's not stated there, but the regulation 2014, you can see the same list of prohibited antibiotics, hormones, and chemicals in animals.
Okay, moving on. Are approved animal drugs the only drugs that can be legally used in animals? And how does an animal drug obtain approval from the MPRA for use?
So that is on the approval of the animal drugs. Veterinarians, they can use human products or human formulations too. And this is termed as extra label use. So extra label use, in the food animals is permitted only by or under the supervision of a veterinarian, and it's only allowed for therapeutic purposes. Okay, and second question, on how to get approval, from NPRA, I would advise that possible, visit the official portal of NPRA for product registration. And there are a few steps that you need to follow. The first one is the pre-submission of the application, which means preparation of the documents that is required for the product registration. There, I think the applicant or the company who wants to register the product need to provide details on the drug based on clinical trial data, the bioequivalence study, the safety, efficacy, toxicity study, and others. After that, it's followed by submission of the application, then screening, followed by evaluation of the application. So evaluation is it will be evaluated by a panel of expert people. At times, I'm given the opportunity to evaluate the product based on the efficacy and the safety, the toxicity. So this is like based on my experience and my knowledge. I will give my expert opinion and will compile all the information. Later on, they will inform whether the product it can be allowed to be registered. And the final process is the post-registration process, which I think you can look at what needs to be done at the portal of NPRA.
Do current trends in drug use affect the legality of a drug?
Okay, so this is an interesting question and very difficult to answer, but I'll try my best. This is based on my experience. We had an issue, early last year, where the problem or the issue was veterinarians using the TKX formula. This is I'm sure you have heard of it, TKX, tilatamine, zolazepam, ketamine, xylazine. So as an anesthetic agent to animals. Okay, the issue here was according to the Poison Regulation 1983 on psychotropic substances, Part 4. It explains about the administration, dispensing, compounding, and mixing of and manufacture of psychotropic substance. Under that, I mentioned Part 4, is it? No, it's Part 6 actually. Part 6, Regulation 17. So here it says that no person shall dispense, compound or mix any psychotropic substance with any other substance, whether a psychotropic substance or not, for the purpose of being used for medical, dental or animal treatment, unless he is a licensed pharmacist or a pharmacist in the public service. So, which means only a licensed pharmacist can do that, or a pharmacist in the public service. Okay, so whereas in the practice currently, the veterinarians, especially in the large animal practice, and also in small animal, they are using this combination. And I would say, in other words, it's sort of like mixing or compounding the psychotropic substance. The meeting was held by Department of Veterinary Services, and then the experts were invited, and then the members from the industry associations were called to deliberate on this issue. Our solution to this problem was to inform the Pharmacy Enforcement Division, Ministry of Health, to reconsider and add this veterinary practitioners or veterinarians in the regulation of the Regulation 17 that I mentioned earlier on psychotropic drugs, Regulation 1980, to allow these veterinarians to compound or mix the psychotropic drugs for the purpose of treatment of animals. That is our current practice. We do the mixing of the TKX, and we won the Pharmacy Enforcement Division or unit of the Ministry of Health to amend or to add in veterinarian, because at the moment it's only pharmacies, okay, and we want veterinarians to be added in the Regulation 17. Psychotropic Drugs Regulation 1989.
I'm sorry, Doctor and Jaya, but I have a question for Dr. Arifah.
Yes, sure.
So this TKX formulation, since it's like a current practice. It's like, well, yeah, it's been used in veterinary practice for a lot of fields, such as for small animals, large animals, and so on.
Yes.
So for now, is TKX legally is done? The formulation.
The formulation, I think, that's the current practice, So we want to legalize that because recently there was a case, where they went for normal routine checking of clinics and practices, in a state, I wouldn't want to mention, which state and where. So there was a complaint that came from the Pharmacy Enforcement Division saying that if you follow the act, it's not allowed because it says that licensed pharmacists, if you want to compound and mix, it's written that compound and mix. So compound is a big word, but the mix everybody understands, So TKX is actually like mixing few drugs, into a formulation, as an anesthetic agent to small animals, large animals, also in wildlife. It's common actually. The practice is common in overseas too. But the law, the regulation, under the psychotropic substance regulation 1989. In Malaysia, it says only by a licensed pharmacist. So we request, as from the DBS department and also other veterinary associations like MSAWA, MAFMA, and other industry players. We propose, the law or the regulation. I would say, not the law. The regulation should be amended. Okay, where we should allow the veterinarians also to mix the drugs.
Okay, I see.
So it was only the proposal. I think we only proposed last year, but I'm not sure. It will take time. But at the moment, I think that is the current practice, by us veterinarians, Even if you ask me, if you read papers and so on, so it is being said that it's a safe anesthetic practice, with a broad safety margin, and it's being used for routine surgical procedures in pet practice, animals and other species, and it also being taught in the DVM program of UPM and UMK. Am I right, Ada?
Yes. We've used TKX in surgery.
Yes.
Yes, in OHE.
Okay. So so even in UPM, if we did seek opinion from the anesthesiologist, she did say that it's a common practice, and they do teach about TKS formula to students, So that's why people outside there, they are practicing.
Yes, because it's also much cheaper if we're using that instead of only carbamazepine, or also if we only gas inhalation.
Yes, exactly. Because like gas inhalation, you can't get in small clinics. They cannot afford. So therefore, it's cost effective. Plus, it has broad safety margin. In terms of efficacy, good, toxicity less, and these were the points that we wrote in the proposal, to allow the veterinarians to mix the psychotropic substance.
Okay, I see. Thank you, doctor. I'll pass this to Jaya.
Oh, sure.
All right, and for the last question, we all know that some farmers, they do practice adding antibiotics in their livestock feed. Why is this a dangerous practice, and how does it correlate to banned drugs in Malaysia?
Okay, so talking about farmers using this antibiotic in livestock feed. I believe that it's not a good practice, but many are doing it at the moment. But this is actually kind of a very big issue. Because as I know, not all the farmers have the knowledge on the prudent and appropriate usage of antibiotics. And I'm sure some of them, they don't even know about, what antibiotics are prohibited. Yeah? Therefore, the concerns, due to the incompetence, of the farmer, then the lack of knowledge, and the all these factors, they could contribute to the differing perceptions of antibiotic use. And in certain cases, the antibiotics, they are overused or misused. Okay, so this is based on their farmers' personal judgment or experience, using that antibiotic, which eventually, could be an ultimate driver for the emergence of antimicrobial resistant bacteria. Okay, and some farmers, they may or may not be aware of the significance, of the problem encountered with AMR. This is a very important point, to highlight, that it's not a good practice to use antibiotics without the supervision of a veterinarian, because the farmers, they might not understand the residual effect, that may cause harm to the consumers, or maybe a risk to the public health. Do you agree with me, Jaya?
Yes, doctor, I do agree with doctor's explanation just now.
Okay.
Thank you, Doctor, for the explanation. Alright, to sum up for today's episode, there are a few veterinary drugs that are banned, and most of them are actually antibiotics that are used in food producing animals. And the reason why they are banned is so that we want to prevent the risk to public health. And they are also banned with proof and evidence based on research and data that has been collected. Thank you so much, Dr. Arifah, for being here today. And thank you so much to Ada and our listeners for joining us today. Have a great day, everyone, and we'll see you again on our next episode.
Thank you to Ada and Jaya.
Thank you to Dr. and Jaya too.